hear me? We are about to start. So, distinguished delegates, colleagues, first of all, I would like to welcome you all at the lunch of group of friends in support of water, sanitation and hygiene, WASH, in healthcare facilities. We are very grateful for your participation and support. I am very pleased to be here today with my colleagues from the Philippines mission and from the WHO. I am Zsuzsanna Horváth, permanent representative of Hungary to the UN. And let me also introduce my colleagues. His Excellency, Mr. Enrique Manalo, permanent representative of the Philippines to the United Nations, and Mr. Stuart Simonson, Assistant Director General of the WHO. We will also have a pre-recorded statement from Tedros Adhanom Ghebreyesus, Director General of the WHO. Water, sanitation, and hygiene services in healthcare facilities are fundamental for the provision of quality, people-centered care. Such services reduce healthcare-associated infections and serve to uphold the dignity and human rights of all care seekers and their families. This is especially true for vulnerable and marginalized population, including mothers, newborns, children, and minorities. WASH in healthcare facilities is crucial to providing quality care and preventing the death of millions who currently die because of unsafe, poor healthcare services and lack of access to clean water, proper sanitation, and hygiene services. And yet, the statistics concerning inadequate WASH in healthcare facilities worldwide are staggering. According to the Global Progress Report on WASH in healthcare facilities, 1/3 of healthcare facilities lack access to hand hygiene at points of care. 1 in 4 facilities have no water services, and 10% have no sanitation services. This means that 1.8 billion people use facilities that lack basic water services, and 800 million use facilities with no toilets. Across all regions, WASH services in too many healthcare facilities continue to fall short of WHO and national standards. Hundreds of thousands of healthcare facilities are not centers of healing, but rather centers of infection across Africa, Asia, and Latin America. Pathogens are not contained, and disease spread through humans and through medical waste. Currently, such services are even more important in preventing the spread of COVID-19 and safely treating those infected. WASH is the first line of defense against COVID-19, a virus that thrives amidst the inequities in our societies and our health systems. The pivotal role of WASH has always been a top priority for Hungary, and we also have a prominent role and experience in the field of water, hygiene, sanitation, and hand washing. I would like to shortly introduce the legacy of Ignác Semmelweis, a Hungarian doctor and obstetrician who was faced with a serious medical problem in the 19th century, namely childbed fever observed in young mothers. At that time, the cause was unknown. Seeking the origin of this devastating disease, he made a breakthrough discovery. The problem can be prevented simply by disinfecting the hands, and he realized the essential need of hand washing. After his method was introduced and put into general use, the number of deaths from childbed fever dropped to a minimum. This revolutionary discovery applied in all around the world, and it is possible to state that his life work affected medical science as a whole. Hungary is still very active in the field of WASH at national and global level. Concerning Hungary's international development policy, Hungary's official development assistance increased to over $480 million in 2020. Last year alone, Hungary dedicated nearly $6.5 million to water sector projects in developing countries, the majority of which was channeled to Laos, Indonesia, Serbia, Mongolia, Albania, and North Macedonia. To mention several recent examples of our successes, Hungary equipped 3 schools in a refugee settlement located in Uganda with innovative potable drinking water systems. We also provided mobile purification systems to Kyrgyzstan to support their peacekeeping efforts and contributed to the reconstruction of Iraq's water and irrigation systems. Besides our bilateral projects, Hungary has a prominent and leading role in several international initiatives, and we have many multilateral partnerships too. Later on at the upcoming meetings of this group of friends, we will inform you about our projects, good practices, partnerships, and initiatives. So these are the exact reasons why we are aiming to take a leading role in this initiative. We really hope that we can effectively and efficiently work together with the committed member states and make progress regarding our challenges. Let me finally introduce the main objectives of this group. Raise awareness of and concerns for WASH in healthcare facilities among UN member states and other public and private stakeholders in connection with the UN, and advocate for inclusion of WASH in healthcare facilities in high-level agendas. To seek to build coalitions among member states, civil society organizations, research institutions, and academia, and other relevant actors to collaborate on the needed assessment, operational planning, monitoring, maintenance, education, and health systems integration in order to redress the very solvable inadequacies of WASH in hospitals, health clinics, and birthing centers wherever needed. To serve as an informal platform at the UN to exchange information, share best practices, support initiatives, and mobilize resources directed at addressing WASH in healthcare facilities. Now, I would like to pass the floor to His Excellency, Mr. Enrique Manalo, Permanent Representative of the Philippines to the United Nations.
Thank you very much, Ambassador Horvat, for giving me the floor. And good morning to all who are participating with us today. WASH in the healthcare environment is a foundation for strong health systems. WASH services are the most essential means to combat antimicrobial resistance, ensure infection prevention and control, and provide safe environments for maternal and child care, and the most fundamental criterion in achieving the goal of universal health coverage by the year 2030. Confronting this urgent crisis, UN Secretary General Antonio Guterres announced a global call to action in March 2018, emphasizing that to WASH in healthcare facilities is fundamental to the achievement of universal health coverage. It is also central to progress in achieving the Sustainable Development Goals. The global call to action by the UN Secretary General helped elevate this critical issue among all UN agencies, partner organizations, and member states. An ambitious response to this call has been prepared, urging countries to undertake a number of key activities, such as assessing conditions, setting targets for improved services, budgeting and implementing programs that are continuously monitored to ensure sustained services at appropriate standards. Investing in water, sanitation, and hygiene is a necessary foundation for a healthy and productive population. It is a key intervention in preparedness and ensuring strengthened health systems. These investments not only save lives, but also provide economic benefits. WASH in healthcare facilities needs to be a strong focus in our recovery from COVID-19 to build back better and stronger. The Philippines is pleased to co-chair the group of friends to support of WASH in healthcare facilities. Our Department of Health, in partnership with the World Health Organization, developed the Green and Safe Health Facility Manual as a response to the global call of minimizing the carbon footprint of the health sector. The manual sets the minimum green and safe standards for all hospitals and other health facilities. Water efficiency, sanitation, and hygiene was included as one of the performance standards in the manual. The Philippine Department of Health ensures water safety and facilitates health risk assessment and management through the WASH, Water Safety Plan, and Sanitation Plan. This new group of friends will work with other groups of friends in areas such as water, antimicrobial resistance, neglected tropical diseases, and others to bridge two of the most important SDG goals. SDG 3, to ensure healthy lives and promote well-being for all at all ages, and SDG 6, to ensure availability and sustainable management of water and sanitation for all. We also envision that our efforts and success to advance WASH in healthcare facilities would substantively contribute to the agendas of other SDG goals, including sustainable communities, gender equality, climate action, and others. Along with Ambassador Horvath, I wish to thank those who already expressed interest and/or commitment to join this important group of friends, and we look forward to welcoming new members in the weeks ahead. Now I would like to give the floor to Mr. Stuart Simonson, Assistant Director General of the World Health Organization, to introduce the pre-recorded message of the Director General of the World Health Organization. Thank you.
Excellencies, Ambassador Horvath, Ambassador Manolo, thank you for your initiative, your leadership, your vision in launching this group of friends in support of water, sanitation, and hygiene, or WASH, and healthcare facilities. My colleagues and I at the WHO are grateful to you both. And let me also express my gratitude to the permanent mission of the Philippines for hosting today's launch. Ambassador, my colleagues and I are also grateful to you for your generosity and your hospitality. Now I'd like to introduce the Director General of the World Health Organization, Dr. Tedros, for opening comments.
Excellencies, dear colleagues and friends, my thanks to the permanent missions of Hungary and the Republic of Philippines. Köszönöm szépen, Marming Salamat. The Hungarian physician Ignaz Semmelweis showed that simple hand washing by health workers saves lives. The medical establishment of the time rejected his ideas, but history and science have vindicated him. And yet, more than 170 years later, hand washing is not available in more than 1 in 3 health facilities. 1 in 4 lack basic water services, and 1 in 10 have no sanitation. Putting WASH in healthcare facilities is one of the best investments. It can help to stop the spread of disease and antimicrobial resistance, keep mothers and babies safe, and much more. Thank you for your commitment to this vital issue. We urge you to advocate for the recommendations in the WHO UNICEF Progress Report. First, to implement national roadmaps with appropriate financing. Second, to monitor progress in improving WASH services. Third, to support the health workforce to sustain WASH services and practices. And fourth, to integrate WASH into health programming, including the COVID-19 response. WHO is pleased to provide a secretariat to support the group of friends to make water, sanitation, and hygiene a reality in every health facility everywhere. I thank you.
As Dr. Tedros and Ambassador Horvath have indicated, some 170 years ago, the great Hungarian physician Ignaz Semmelweis discovered that hand washing prevented what was then a common cause of maternal mortality, purple fever or childbed fever. But 170 years later, more than 1.8 billion people around the world do not have access to reliable, adequate WASH services. So in the second decade of the 21st century, millions of mothers face essentially the same peril as mothers of the 19th century. Like the people they serve, hospitals and other healthcare facilities in low-income settings suffer from the same lack of access to basic WASH services. As we saw with Ebola, we see today with COVID. Hospitals without reliable, meaningful access to WASH services are breeding grounds for infectious diseases and a threat to human health and community health and beyond. But this problem, first identified in the 1850s, is eminently solvable today. We need no scientific or technological breakthrough. Semmelweis and the other germ theory scientists did that for us more than a century and a half ago. What we need is political will, a sustained commitment to bring adequate, reliable WASH services to hospitals and healthcare facilities around the world. WASH is a global public good, and as Ebola and COVID have shown us, WASH is inextricably linked to human health and health security. The economic benefits of WASH are about 5 times costs, and instituting reliable, meaningful WASH services can generate savings in health expenditures of up to 15 times cost. So WASH is not only good health policy, it is a sound investment in infrastructure and good value for money. If we are committed to building back better from COVID-19, a 21st century problem, we must first resolve a problem from the 19th century and bring reliable, meaningful WASH services to hospital and healthcare facilities in every country on earth. If we are committed to this in both word and deed, it will happen. And then all peoples of the world, not just those living in higher income countries, can finally share fulsomely in the benefits of the work of Ignaz Semmelweis, Louis Pasteur, Robert Koch, Joseph Lister, and the other medical pioneers of the 19th century. I would now like to invite my colleague, Bud Rock, to give some additional perspectives on the WASH crisis and some of the tools available to assist countries to improve access to WASH. Bud?
Thank you very much, Stu. And let me first join in thanking our co-chairs, the permanent representatives of Hungary and the Philippines, for their commitments and leadership and for the actions of their own countries to address this critical issue. It is not difficult to understand that fully functioning and sustainable water, sanitation, and hygiene services in healthcare facilities are indispensable to quality of care, to disease prevention and management, and in strengthening healthcare systems from the largest hospitals to the smallest primary health clinics and birthing centers. These services guarantee environments that respect the safety and the dignity of all care seekers and of healthcare providers alike. And yet, as already noted, millions of mothers today face the prospect of giving birth in facilities without WASH services. Hospital beds are filled with patients, many of whom, either children or primary wage earners, are suffering from water-related illnesses and no access to safe water or soap. Hospital-acquired infections are rampant, and they are carried back into communities from local health facilities. And healthcare providers are at particularly high risk in this circumstance. I know that the statistics that have already been mentioned often mask the real human tragedy of this deficient healthcare environment, and yet the statistics concerning inadequate WASH in healthcare facilities really are staggering. When we speak about 1 in 4 healthcare facilities lacking basic water services, 1 in 5 lacking adequate sanitation services, and the impact on nearly 2 billion people worldwide, these are conservative estimates. Across the world's least developed countries, the problem is even greater. Half of the healthcare facilities lack water services, for example. More than 1 million deaths each year are associated with unclean births. Unwashed hands, contaminated beds, unsafe water, dirty instruments. These all contribute directly to these tragic circumstances. Conversely, when hand washing and clean birthing practices are in place in the healthcare setting, newborn survival rates increase up to 44%. And hand washing alone can reduce diarrheal disease by 45%. There is no better place to ensure this than in the healthcare facilities themselves. I want to echo the words that our co-chair said at the very beginning. When pathogens are not contained due to absent or substandard WASH services, these facilities are not centers of healing, but rather they are indeed, as stated, centers of infection. And yet this is a crisis in which solutions are within reach at very reasonable cost and with high value return on investment. The global call to action on WASH in healthcare facilities issued by UN Secretary General Guterres in 2018 focused attention on the issue among member states, UN member states, with the support of UN agencies. The member states unanimously adopted the resolution on WASH in healthcare facilities at the 72nd World Health Assembly in 2019, highlighting the imperative for action. I'd just like to take this opportunity to personally thank several countries that were the first to introduce and co-sponsor this resolution. Zambia and Tanzania introduced the resolution with the co-sponsorship of Eswatini, Ethiopia, Kenya, Nigeria, Brazil, the United States, Indonesia, and Australia. We are grateful for their leadership and where it has taken us today in terms of member state support. WHO, UNICEF, and their partners have prepared an ambitious plan to support and advance the Secretary General's call to action. It has ambitious targets for basic WASH services by the year 2030 and detailed metrics for success along the way. The plan includes 8 so-called practical steps to help countries assess conditions, set targets for improved services, assign responsibilities appropriately, budget and implement programs that will be monitored continuously and ensure sustained services at appropriate standards. And most importantly, seeking global assistance to achieve these important goals. With our thanks, these UN organizations, notably WHO and UNICEF, are also offering extensive support to help countries understand and implement these very necessary actions. Their support reaches literally to the health facilities themselves with the so-called WASH Facilities Improvement Tool, or WASH Fit. This is a risk-based planning tool to incrementally improve WASH services in healthcare facilities. The tool is already being utilized very effectively in over 40 countries with training and support by WHO. Some countries have been making genuine progress in responding to the crisis, closely working through these 8 practical steps and using these UN-provided tools. And their efforts are inspirational. But COVID is jeopardizing these efforts, even reversing some gains made by countries to date. Without question, the current global pandemic has sharpened the focus on the crisis, but it has also exposed the need for investments in infrastructure and training and maintenance and continuous monitoring. The impact of COVID-19 on already weak health systems has been unprecedented, and the most effective and immediate action by governments, funders, development assistance organizations alike is to ensure adequate WASH in healthcare facilities. This will forestall this pandemic and protect against inevitable health crises that are looming in the future. The new group of friends can be instrumental to mobilize the activities across the entire UN system to assist countries to address the crisis. The group represents a new informal platform at the UN that will raise awareness and exchange information, share best practices, mobilize initiatives, and mobilize resources. And most of all, the group sends a powerful message that resonates throughout the UN system. WASH in healthcare facilities is foundational for strong health systems and universal health coverage. It is key to the success of the Sustainable Development Goals. Again, I thank the co-chairs, our permanent representatives of Hungary and the Philippines, for their leadership in launching this very important new group. And we look forward to providing any additional secretariat support that the group of friends deems necessary to fulfill its mission. Thank you very much for the opportunity to speak on the issue. Stuart, I'll turn it back to you. Thank you.
Thank you, Bud. I now want to open the floor to interventions from member states and other groups of friends. Please indicate your wish to take the floor by the raise the hand function or using the chat box. After the open floor segment, we'll have a brief, very brief Q&A section. So please indicate any question you have in the chat box. I would first like to invite Ambassador Kimura Tatsuya to deliver his remarks on behalf of the co-chairs of the Group of Friends of Universal Health Coverage. Ambassador, you have the floor.
Thank you, Assistant Director General Simonson. I would like to congratulate the Water Sanitation and Hygiene Friends Group on its launch today. Japan, together with Georgia and Thailand, has been leading the UHC Friends Group and has been making efforts to promote universal health coverage at the United Nations. The COVID-19 pandemic has demonstrated more than ever the importance of UHC. Based on the principle of leave no one's health behind and human security, We will continue to actively promote UHC with an eye on the high-level meeting in 2023 and the G7 summit in 2023, which Japan will host. In order to achieve UHC, it is important to promote health system strengthening, HSS, with a long-term vision. In this regard, WATCH is a key component of the UHC Service Coverage Index to measure the progress of UHC. Improving health system performance also requires country, regional, and global action in 3 interrelated health system policy areas, that is, service delivery, financing, and governance. The service delivery needs of health cannot be addressed by the health sector alone. In resource-poor settings, synergies have been achieved as often scarce public health personnel have worked closely with water and sanitation technicians and community mobilizers, and collaboration with the water and sanitation sector has been strengthened. In terms of financing, the Addis Ababa Action Agenda recognizes that the main mechanism for meeting the resource needs to achieve the SDGs should be domestic, but it is also important to strengthen coordination between health and finance authorities. In addition to leveraging the investment capacity of the private sector, investment in other sectors such as education, water and sanitation, and transportation could be better coordinated with policies and targets to improve key health outcomes at lower cost. This collaboration and coordination of activities with WATCH and other closely related sectors is important for health system strengthening and UHC dissemination. On October 7 and 8, the Tokyo Nutrition Summit was held in Tokyo. It was pointed out in the Tokyo Compact, which was endorsed at the summit, that resilient systems such as WASH, education, and agriculture are essential to protect people from worsening nutritional status. Thus, WASH is not only a public health issue, but also a development issue and is related to other key issues of the SDGs, such as antimicrobial resistance, climate change, food system, and food security. The UHC Friends Group hopes to work in close collaboration with WASH Friends Group in the future. Finally, in commemoration of UHC Day on December 12th, the UHC Friends Group is planning a hybrid event next Monday, December 13th, and we hope you will join us. Thank you very much.
Thank you, Ambassador Kimura. I would now like to give the floor to Ambassador Sonia Pereira, Deputy Permanent Representative of Colombia to the United Nations. Ambassador, the floor is yours.
Thank you, Mr. Simonson. Good afternoon, Excellencies, colleagues, friends. I want to express my gratitude to Ambassador Susana Horvath and Ambassador Enrique Manalo for convening this launch event and inviting Colombia to participate in this group of friends in support of water, sanitation, and hygiene in healthcare facilities. This is a priority for the government of Colombia. Colombia has supported the 2018 UN Secretary General Global Call to Action to improve access to WASH in healthcare facilities and recognized the importance of the Resolution 7227 adopted in 2019 by the World Health Assembly. Water and sanitation should be accessible in all settings, and especially in healthcare facilities where people are most vulnerable. Lack of WASH in healthcare facilities hinder the ability to maintain hygienic environments and prevent infections, leading to unnecessary use of antibiotics and contributing to antimicrobial resistance. For this reason, President of Colombia, President Iván Duque, has been increasing Colombia's capacities to address drinking water and basic sanitation services effectively. As a result, urban service coverage has increased to over 19% in Colombia. However, indicators show an urban-rural gap of more than 20%. These and other challenges, such as the lack of comprehensive data, should guide the forthcoming work of this group. Ambassadors, my delegation is of the view that this group of friends should serve as a platform to share best practices and experiences that contribute to explore further measures aiming to address the challenges of assuring wash in healthcare facilities. I'm pleased to express the interest of Colombia in joining this group of friends. We are confident that Colombia's national background and regional leadership in water and sanitation services will add value to the common views of this group. To conclude, ambassadors and colleagues, you can count on our support and active participation in the work ahead towards the intensification of the multilateral dialogue on the field of water and sanitation in healthcare facilities. Thank you very much. Muchas gracias.
Thank you, Ambassador Ferreira. I now turn to the acting deputy permanent representative, the permanent mission of Egypt to the United Nations. Excellency, the floor is yours.
Thank you very much, Excellencies. It gives me great pleasure to join you during the launch of the group Friends in support of water, sanitation, and hygiene in healthcare facilities. Allow me to express our gratitude and appreciation for the permanent missions of Hungary and the Philippines for their initiative to launch this very important platform, which represents a significant avenue for raising awareness about the importance of WASH in healthcare facilities and exchanging best practices in this regard. I also thank the WHO DG for his statement and welcome the participation of Assistant DG Mr. Simonson and Mr. Rock from WHO. Statistics show that 2.2 billion people still lack access to safe drinking water. Over 4.2 billion people cannot reach safe sanitation, and 3 billion people do not have access to hand washing facilities. The consequences of unsafe water, sanitation, or hygiene can be fatal, and therefore, enhancing WASH in healthcare facilities has a critical role in preventing the spread of infectious disease, contributes to saving lives, and is vital to the safety of health workers and patients. Ensuring the availability and sustainable management of water and sanitation for all per SDG 6 is indispensable to livelihoods. This issue gains additional importance during the time when the COVID-19 pandemic has put additional pressure on our health and economic systems. We realize the importance of continuing the efforts to implement our commitments towards achieving universal health coverage in parallel with our efforts to continue implementing the 2030 Agenda for Sustainable Development. The government of Egypt remains committed through Egypt's Vision 2030 for sustainable development to enhancing the healthcare services provided to its citizens and continues to expand the provision of universal health coverage for all, while carrying out several projects in the framework of developing and upgrading the infrastructure in rural areas, which included advancing water and sanitation provisions and enhancing the number and quality of healthcare facilities. Excellencies, the lack of access to health services, low levels of literacy, inadequate nutrition, and poor personal hygiene only leads to the further spread of diseases which cause severe health complications and leave negative socioeconomic impacts. We therefore welcome the launch of this group of friends and are pleased to join it to continue our discussions on the best way to improve the provision of safe and adequate WASH in healthcare facilities within our efforts to promote the right of healthcare for all. And we look forward to the rich exchanges in this regard. I thank you very much.
Thank you, Excellency. I now turn to the permanent mission of Nepal to the UN. Excellency, you have the floor.
Thank you, Excellency. I have to speak without video because of some technical issues here. Excellencies, colleagues, I would like to thank the permanent missions of Hungary and Philippines for organizing this event of officially launching the group of friends in support of water, sanitation, and hygiene WAS in healthcare facilities. This initiative is a timely effort to implement the 72nd WHA resolutions in achieving the universal health coverage and goal 6 of the Agenda 2030. Furthermore, it will also complement the UN call to action to WAS in HCF and water, sanitation, and hygiene world leaders call to action on COVID-19 also. Access to clean water, adequate sanitation, and good hygiene are more important not only to prevent the public health emergencies, but also to support the vulnerable population during the pandemic like COVID-19. In our case, clean water and sanitation and very basic health services are enshrined as a fundamental right of every citizen in the Constitution. Nepal is making efforts through devising policies and programs to ensure WAS to its people. The long-term sectoral development plan 2017-2030 have aimed at ensuring clean water and sanitation for all by 2030. The National Health Policy 2019 is focused to ensure the access and quality of health services for healthy and productive life of every Nepali citizens. There should be a strong cooperation among international community to achieve WAS. Nepal is always ready to work with the group of friends in support of water, sanitation, and hygiene WAS in healthcare facilities as a fellow member of this very group. I thank you.
Thank you, Excellency. And I want to thank all of the participants for their interventions and active participation. I now hand it back to our co-chairs to close the meeting. Ambassador Manolo, the floor is yours.
Thank you very much. Thank you very much. Excellencies, colleagues, to launch this effort, we would like to invite our UN colleagues to bring our strengths and our ideas together in the form of this new group of friends on WASH in healthcare facilities. This is an opportunity for us to dedicate ourselves to the welfare and dignity of those in need now and for the future. Fully functioning WASH services at all healthcare facilities are indispensable to universal healthcare in this time of grave pandemic threat and beyond. We look forward to working with member states and other health-related groups of friends as we recover from COVID-19 to build back better for a more sustainable and equitable future, which includes adequate access to WASH at healthcare facilities for everyone, everywhere. And if I could just add, in response to Ambassador Kimura Tetsuya's remarks just earlier, I just want to confirm that I will be attending the Universal Health Coverage Day on Monday in recognition of the synergy between the aims of the group of friends of UHC and the group of friends of WASH in healthcare facilities. Thank you very much. I now have the pleasure in handing over to Ambassador Horvath.
Progress depends upon the strong voices of national and global leaders to help make water, sanitation, and hygiene in health facilities a priority for the benefit of women, children, and ultimately for all citizens. When nations commit to address this crisis, global support will follow. The new group of friends of WASH in healthcare facilities is created for precisely this purpose. Let us use this new group to bring our voices and our wills together in this important task. It will require our shared commitment, leadership, and passionate appeal to the global community for support and much needed assistance. I'm excited to join my colleague as co-chair of this important effort and urge my fellow permanent representatives to join us as well. Once again, I would like to thank to all of you, the participation and your support for this launch event, and I'm looking forward to working together on this important topic.